Hello, I'm Brooke with Incorporate Massage. Thank you for joining us today. We're going to go over a technique to help solve, prevent, and treat thoracic outlet syndrome. So thoracic outlet syndrome is sometimes confused with carpal tunnel, but a lot of times it can be just a painful shoulder all the way down to the arm. So various different types of symptoms, but if anyone has arm pain extending from the shoulder, then it is said to be an impingement of the brachial plexus nerves, which is one of my favorite ones to work in. So I'll show you a couple techniques, and they can get a little bit fancy, but I'll show you the basic area of what and concept and intention behind what you should be working on. This is Holly. Thanks for being my volunteer today. So Holly, I removed one of my knee pads. Let me just put it back on here so you're not lopsided. Okay, so Holly, have a seat, please. Carefully, slowly, carefully. And good. Okay, raise that chest piece up to where you want it, and I'll lock it in place for you. Do that one. And then face rest. Again. Oh, let me loosen the toggles here. Right there? Mm-hmm. Okay. So your client won't be in this position for too long during this technique, but they will at first. Okay, arms. And how's that? Okay, so the way I begin every massage, does anybody remember? Either hands or forearms on either side of the spine, and I just wait for breath. If you don't feel the breath from your client, you can call for the breath. Take a nice big deep breath for me. And the first thing that I notice is which side of the spine is moving more than the other. It's how I begin everything, no matter what it is. It just helps me find where they're holding the stress of the pain. So even if the pain is on the right and you feel that the left side of their spine is moving less, that to me says that the left side is holding because the right side hurts, okay? And it could be opposite. Everybody's structure and posture is completely different and unique to them, so that's why I find that spot first. So as soon as I find that spot, that's where I work initially. So how I might work on that is a little petrissage, very, very light compressions. My technique and my pressure isn't more than medium. And all that's in my intention is just getting that spot to move. Holly, this wasn't a spot that I felt not moving. I'm just demonstrating, so just so you know. So just some good movement to kind of tease the area loose to try and provide a little bit more breath, a little bit more movement, and get rid of that holding. And that client's gonna say, oh, that feels good. I don't need to be tight there anymore, and they can let that go on their own. Okay, so as soon as 1 minute or less, doesn't have to be extensive. That's not where their big problem is, right? So as soon as you feel like that's loosened up a little bit more than when you started, you would go over to the side that hurts. So on her, it's going to be her left side. Left side can be pretty typical. A lot of times it's just the mousing side, so whichever side they use their mouse on, that's a really typical one. A good test you guys can do to kind of see this, how this affects people for yourself, is if you hold your armpit, your pec right here, give that a good hold, and then press your palm into your hand so you feel it flex, and then press your fingers, and you'll feel little teeny tiny micro movements in your chest. Does everybody feel that? So if you can imagine that happening all day long, several times a day, repetitive task injury, right? And it's just that teeny tiny little micro movement in there that's causing stress and strain. Okay, so she's on my chair here, and I know that the brachial plexus starts up here in the neck, and the spot that we want to venture to is by their collarbone right here. So it's kind of this scalene area that goes into the collarbone. So with supported thumbs, I get my hands out wide, and then I'll pick up the traps. So my thumbs are in this collarbone area, but there's no pressure applied. It's just kind of, I've moved the trap out of the way to apply that pressure. So Holly, how much pressure am I using right now?
Not very much.
Okay, how does it feel?
Feels pretty good.
Okay, so that's one thing that I'll sit and wait on, okay? So your body mechanics in this, see how my shoulder's up in here? As soon as you find a place to just sit and wait and rest, check in with your body, check in with yourself, because if your hands are, shaking and they're straining and they're hard like that, you're just going to transmit stress into their system. So once you've got something to hold, relax your shoulders, find an easier spot for your feet, plant your feet into the ground, connect to the earth, find support, and make sure that your body is at ease before you go any further. And the whole time that you're holding this spot for them, you're working and they're getting the benefit. But what you're doing is making sure that your body's okay and that you're not gonna get hurt and you're not gonna get Thoracic Outlet Syndrome, right? So, and then as I just started doing automatically, I start swaying side to side just to, again, introduce more ease to my system. And Holly, can you feel me moving?
Barely.
It's a very deep movement. So I'm trying to encourage the deep structures of her scalene and thoracic outlet over here to move without me having to dig my way in, right? So with this movement, with this subtle movement of my body, it's going to transmit really deep inside of her without any effort on my part. So I just felt her shoulder drop. So as soon as you feel some relaxation and that trap just move, you've done your job. And it doesn't take that long. Okay, so once I've got that down, this is when I'll take my elbow and find a nice cozy spot that I can nestle my elbow in. So I'm working like this part right here in our trap. So it's just right above where my thumb was. And then I'll come here, so my closest hand to the client is on her trap, and I'll take her arm, and this is where I'll gently move the arm. Now, I also like to come up alongside and really get up underneath that armpit. Now, some people might be conscientious about their sweat or something like that, so if you feel them kind of clenching away, shying away, then don't do this. But if they're not shy about it, then I will just get my arm right up underneath there and I'll lift the shoulder up into my elbow. Again, not applying any pressure on my part. Holly, how's the pressure?
Pretty good.
Is there enough pressure for you?
You can go deeper.
Okay, so if she needs more pressure, and this is something you could ask in this position because you've got her arm sandwiched, so I'm pulling up and pressing down at the same time. If she needs more pressure, I don't have to muscle it, I can just lean my head next to her. Did that apply enough pressure?
Mm-hmm.
Okay, so again, you can sit there, or you can just do some shoulder circles and just move it around. So in my mind, when I feel like I'm doing what the intention of my work is to just tease that brachial plexus loose from whatever it might be stuck to. So I'm envisioning the pathway of the nerves, and I'm just envisioning them just getting unglued, and I'll just roll that arm around. Okay, so once I feel like that has had a softening effect, now this is where it gets fancy and where you really got to check in with your body mechanics. I'll place my client's forearm on my knee like this, keeping their elbows supported, and then coming down around here, I'll grab their deltoid. Okay, so it looks like that. So I've got their deltoid in my hand right here, and then their trap pinned, and then their forearm right there on my leg. Okay, so in this position, you really got to maintain your body mechanics here. Your forward foot is, toes are pointing forward, and your back foot is at a 45-degree angle, and your hips need to be in a comfortable spot for you. So if you feel like your hips are just like, pinching or in a weird painful spot, move them around. Don't suffer in silence, right? So find a nice comfortable spot for your body, and also be aware of secondary contact. So you don't want to be resting on your client either. You want to maintain an upright position. And then what I do with her deltoid is I just bring it into me like this, kind of like I'm waving hi to everybody over here. So I'm waving hi like that, with her deltoid, and then I'm just walking and using the point of my elbow to get underneath her scapula. Now, why am I going down this way rather than her chest? This is part of the brachial plexus. It is the cranial nerve 10 or 11, I can't remember, the accessory nerve, but it has everything to do with shoulder pain. So once I've reached the end of that scapula, I'll switch legs, put her hand on my other leg, and then I'll pin her teres major and minor area, the lateral border of the scapula, with that elbow. I'll hold her elbow with this one, and that gives her shoulder a stretch. Do you feel that stretch? Mm-hmm. And it's not so much of a stretch as it is a traction. So you're allowing that joint from the collarbone and the shoulder and the scapula to move away. So I've got it stretched here, and I'm sorry, my tassels are tickling you. So I would hold this for a minute. You could maybe move back and forth in and out of the client just to massage that scapula meat a little bit. And then once that's done, switch arms, hold their elbow right there, and then make a really good lunge that's comfortable for you. Now in this position, you want to just make sure that your back is not collapsing either way. So either like that or like that. You want to maintain a good straight flat back. Maybe tighten the stomach muscles. This is not ideal to do for a long time, or for a long time, I guess. So I just roller pin my forearm down her forearm. How's that pressure?
Awesome.
And I'm moving, I'm roller pinning down so that the fascia gets stretched down. And then when I get to her wrist, you can take the elbow again and gently do a two-way stretch. Pull the elbow up, push the wrist down, and then that clears some room for the actual carpal tunnel, because that's where the nerve goes, and that's why there's pain down there, okay? And then you can do some fancy hand stuff while you're there if you have some time. This spot is a really good spot by the pinky. That's a really good one to work to get the carpal tunnel to release as well. So once you've got that, drop the arm, and then get your hand on the palm of your hand, the heel of your palm, right underneath their collarbone, right there, okay? And then your other hand can sandwich the scapula and the chest. And then you just circular motion, and if it's not comfortable for your wrist, change. It's no big deal. And all I'm trying to do, again, is create space or movement or breath, whatever you want to call it, in the brachial plexus complex up here at the scapula and pec. So you can do friction back and forth, slow circles, and just move, and always check in with yourself. If what you're doing isn't comfortable for you, it's not comfortable for them, so change. And don't worry about it affecting their massage, because you're working either way. Okay, so I've got her shoulder all sorts of relaxed and moved, and then come back up here, place it here. Okay, so at this point, to finish off the massage, assuming I did everything else in the massage, I would instruct her to sit up, close, and hold the face rest down, and take a deep breath. How you feeling?
Wow,
Good.
really good.
Okay, put your hands right here for me. We're gonna do a little bit of neck work. Okay, so here is one of my favorite ones, and I use it for the headache one as well. I find her SCM, and I put just very gentle pressure with my fingertips here, and the intention that I'm trying to use is to comb out the muscle fibers with my fingers, okay? So I've got my fingers here, and again, Holly, how much pressure am I using?
Not much.
And I might say something like, if you ever feel like I'm choking you, let me know. But obviously, here, you wanna be as far back as you can. And then my thumbs are at the occipital muscles. Okay, so I've got a good hold on her scalenes. Now, Holly, I want you to look down at your lap. Now look up towards the ceiling. And just go back and forth like that, really slow and careful. So my thumbs are massaging the back of her neck. My fingers are moving and massaging her SCM and her scalenes down towards her clavicle to create a little slack. And then once you've reached the collarbone, rest, and then you can just work out the back of the neck with your thumbs or whatever. Okay, then to end, depending on which side that they're on, tell your client to make a tight fist, and now pretend like you've got a water balloon in your armpit and you're trying to pop it. Okay, so squish into your side, and then find a nice juicy spot on their trap, and then say, drop your opposite side ear to your opposite shoulder there. And then just apply a little bit of pressure. How's that feel?
Good, really good.
Okay, and now if you like, you can play with some head movements. Move your head around as you see fit, but just remember to maintain that squish in your arm, okay? So, and then as soon as you're done moving your head around, just go ahead and drop your arm. That's how you're done. And you can just hang out here while your client does all the work. Another thing you could do if you really wanted to, you could apply a little traction right here, but I wouldn't do very much, if at any, but that would be another option. While they're moving their head around, you could also petrissage it out while they're moving around. But that's more work, so I kind of like to just go. And I think it does just as good of a job.
It does.
Okay, you having too much fun over there? You done yet?
I love it. That's good.
Okay, and that is how I would address the thing we talked about earlier. What's it called? Thoracic Outlet Syndrome.